Type 1 and Type 2 diabetes. Did you know that around 30 million people in the United States have diabetes? However, only about 25% of the population know that they have it. Diabetes is more common than you think. Both Type 1 and Type 2 diabetes occur when the body fails to properly store and use glucose. And as you know, glucose is essential for producing energy. In fact, if sugar or glucose collects in the blood and doesn't reach the cells that require it, it can lead to serious complications. And even though there is hardly anything or very little you can do to prevent diabetes, diabetes can be managed through making conscious lifestyle choices and monitoring your health. In today's video, we have covered everything you need to know about Type 1 and Type 2 diabetes. Continue watching to know more. How does diabetes affect your body? The two main types of diabetes are Type 1 diabetes and Type 2 diabetes. Both these types of diabetes are chronic that adversely affect the way our body regulates glucose or blood sugar. Insulin is the key through which glucose that enters your cells and feeds the body's cells. In the case of Type 1 diabetes, people don't produce insulin, which makes it impossible for glucose to enter your body. And with Type 2 diabetes, firstly, they don't respond as well to insulin and then eventually stop making enough insulin. Both types of diabetes, if not managed, can lead to chronically high blood sugar levels, which can increase the risk of serious diabetes and cardiovascular complications. What causes diabetes? It is a common mistake to think that Type 1 and Type 2 diabetes generally mean the same thing. However, that isn't the case. They are different conditions with unique causes and complications. Type 1 diabetes causes. As you already know, the body's immune system plays an important role in fighting off foreign invaders such as bacteria, viruses, and harmful pathogens. For those who have Type 1 diabetes, the immune system mistakes the body's healthy cells for foreign invaders such as harmful pathogens. The immune system then attacks and tends to destroy the beta cells that produce insulin in the pancreas. Once these beta cells are destroyed, the body is unable to produce insulin. As a result, glucose can't enter the body. Research has still not found the cause why the immune system attacks beta cells. However, it is understood that it must have something to do with genetic and environmental factors. Type 2 diabetes causes. Those who have Type 2 diabetes have insulin resistance. That is, their body still produces insulin but fails to store and use it effectively. Researchers aren't sure why some people are insulin resistant and others aren't. But it generally has something to do with lifestyle factors such as being overweight, being inactive, and poor eating habits, etc. In some cases, other environmental and genetic factors may play a role too. Once you develop Type 2 diabetes and become insulin resistant, the pancreas tries to compensate by producing more insulin. And because the body is unable to use the insulin, glucose gets accumulated in the bloodstream. Risk factors for developing Type 1 and Type 2 diabetes. You are at risk for developing Type 1 diseases for the following factors. The presence of certain genes can increase the risk of developing Type 1 diabetes. People who have a family history of diabetes, that is a parent or a sibling with Type 1 diabetes, have a higher risk of developing it too. Age is the most common factor for developing diabetes. Even though Type 1 diabetes can occur at any age, it is most common in children and adolescents. The farther away you are from the equator, the more are your chances of developing Type 1 diabetes. Thus, geography plays a role too. You are at risk for developing Type 2 diseases for the following factors. If you have an immediate family member who has Type 2 diabetes, if you have PCOS or polycystic ovary syndrome, if you are Black, American Indian, Hispanic, or Alaska Native, if you are over the age of 45, if you carry a lot of weight, especially around the belly, and if you are clinically obese, if you have prediabetes, that is elevated blood sugar levels. Symptoms of Type 1 and Type 2 diabetes. The most common symptoms of Type 1 and Type 2 diabetes are cuts and sores don't heal fast or properly, frequent urination, feeling fatigued and famished, feeling low on energy, having blurry vision, feeling very hungry, increased thirst. In some cases, people with Type 1 and Type 2 diabetes experience mood changes, irritability, rapid weight loss, etc. However, in most cases, people spend years without knowing they have diabetes as the symptoms don't show up. How is diabetes treated? Type 1 diabetes. There is no cure for type 1 diabetes. In most cases, it is treated through an insulin pump or daily insulin injections that provides insulin as and when needed throughout the day and night. Medications such as pramlintide can control glucose levels and stop them from rising too high. Besides, one should follow the treatment plan and the medical practitioner's instructions regarding insulin and glucose testing. In addition, a healthy and active lifestyle must be followed to reduce the risk of serious complications and cardiovascular diseases. Blood pressure levels and cholesterol levels must be managed too. Type 2 diabetes. Type 2 diabetes is less complicated than type 1. Thus, in most cases, patients are given medications to manage blood sugar levels. In addition, those who have type 2 diabetes must follow the doctor's medical advice religiously. A healthy diet must be maintained along with an active lifestyle. It is often advised that those who suffer from type 2 diabetes should quit smoking. Along with that, high blood pressure levels and cholesterol levels must be maintained. The bottom line is that even though diabetes is a serious condition, it can be progressively managed through making informed choices and leading a healthy lifestyle. If you found this video helpful, check out our YouTube channel for more such videos. That's all from us today. We want you to know that your voice is important to us. So please leave a comment below. If you are new here, then click the bell icon for notifications of our new videos. And subscribe to our channel.